COVID-19 vaccines from both Pfizer and Moderna are now being distributed across the nation. The vaccines are being regarded as a hopeful start to the end of the pandemic. This week, long-term care facilities across Indiana are starting to receive the vaccines. Many of you have reached out to us with some great questions about the vaccine. So joining me now live to answer some of them is Dr. Doug Webb, infectious disease expert with IU Health. Doctor, good morning to you.
Morning.
Now, we were talking during the break, and I think I'll start with this one because a lot of people want to know if and when I get the vaccine, what it's going to be like. You were talking about a lot of people you know, including yourself, got the vaccine. So what was that like?
I think it was very smooth. At IU Health, we have a system set up where we had the appointment made. I came in 5 minutes before. They took me through, gave me my vaccine quickly, and watched me for about 15 to 20 minutes, and I had no reaction. And I think we've had over 1,000 healthcare workers now get the vaccine through IU Health. But we've not seen any major reactions with it. Again, it appears to be, from all we can see, a very safe vaccine and effective vaccine. So most of the healthcare workers have been anxious to get it.
Now, it's early on, but do you know if this is something that has to be done every year, kind of like a flu shot, or do we know yet?
No, we don't know. I think we're still learning about the natural immunity of the COVID infections and how long that immunity will last. We thought maybe 3 months. Now we're thinking maybe 6 months, maybe longer. From the studies, it appears that the vaccine may cause a longer lasting immunity, particularly with the second dose. So we're hoping that it's not going to be a yearly vaccine. Maybe it will be maybe an every 5-year vaccine. We'll see.
And when the public is up for getting it, in essence, how do they go about doing that? Do we know yet? Is there a plan in place, or do we have a lot more people to get through before that's even a possibility?
Well, we're trying to hit the highest groups that are susceptible now. I mean, after the frontline healthcare workers and the nursing home residents, there's a group meeting at the State Department of Health to decide what the next wave will be. It will likely be individuals that are over a certain age, either 60 or 70, essential workers, and then eventually made it available to the general public. I would anticipate that that's going to be within the next month or two. We'll see how the distribution of the vaccine goes, but we're hopeful we can see more and more people vaccinated quickly.
What has been in the news lately is the UK variant of the virus. I watched a program and said, like, this is the 4th or 5th actual variant. And do you think it's going to be a major problem? I know they talk about it possibly being more contagious, but not necessarily more deadly.
Exactly. That's our understanding, is that it may be somewhat more contagious, but it doesn't seem to be more virulent or aggressive or cause more deaths. And some of these viruses, again, may develop these minor variations in their genome from time to time, but we don't really anticipate that it's going to be like the flu, where each year we're going to have to adjust the vaccine for drift or shifts in the strains that are circulating in the world. The coronavirus seems to be a more stable vaccine and probably less likely to drift in that such a way. So Moderna and Pfizer, I know, are currently studying to see whether or not these variant strains would be covered by the current vaccine. I think the experts that I read feel that it most likely are covered by the current vaccine, so there probably is no adjustment that's going to be needed.
All right, Dr. Doug Webb of IU Health, thank you for taking the time out this morning. A lot of helpful information. We do appreciate it.
Sure.
All right, if you have a question you'd like to submit, you can do so on our website. We're going to do these more often. Just go to fox59.com/vaccine.